Mr. President,
Senator from Montana.
I want to thank the senator from Louisiana for allowing me to say a few words, and I want to thank you, Mr. President, for doing the same. Mr. President, hopefully today works out better than the last 131 days have, and that hopefully today that a bipartisan group of senators will be able to put forth a budget agreement that will be long-term. And I want to thank them because as part of that, although it isn't done yet, so we don't want to get the cart too far ahead of the horse, but a part of that is funding for our community health centers in this agreement. Funding for community health centers has been a top priority for me, and it became that because of my visits to the the community health centers around the state, from Bullhook and Havre to Riverstone and Billings, to Southwest Montana Community Health Center in Butte, to Partnership Healthcare in Helena and in Missoula, and the list goes on and on. These healthcare facilities provide incredibly affordable and efficient healthcare to people across Montana. So I am incredibly pleased to work with the leadership in this body and get a deal for community healthcare centers across this country, including Montana's 17 community health centers. Now, I will tell you that 2 years is a good start, but there happens to be 19 bipartisan co-sponsors on a bill called the CHIME Act, which would reauthorize community health care funding for 5 years. That's where we really need to be. I'm not complaining about the 2 years. I think it's important we keep these folks going, and 2 years is certainly better than where we are now. But really, we don't look with much vision in this body. And it's really not visionary to say that we're going to give a 5-year funding mechanism to our community health centers, but that's what we need to do today. We need to give the community health centers the long-term predictability that they deserve. In Montana, these centers are the backbone of much of our healthcare delivery system. They provide affordable access to care, keeping our communities and families healthy. Now let me give you a little example of how important these are. Community health centers and community health centers alone provide over 10% of the people of the state of Montana their health care. That's where they go to get it. 85% of those folks are low income. These are folks that probably wouldn't be able to get health care without a community health center there. 20,000 of them are children. In Montana, we're a big state, big geographically with not a lot of folks. So oftentimes folks have to travel a long ways under the best of conditions to see a doctor. If we didn't do this funding mechanism that we hope happens today or tomorrow, we would see these folks be traveling hundreds of more miles to see a doctor, because oftentimes this is the only healthcare facility close to them. So although the news that we've heard today so far seems to be positive, it does on our budget, it doesn't change the fact that Congress should have acted on this 131 days ago. A solution should have been passed when our fiscal year ended in the end of September. It speaks to the dysfunction of this body. Our basic job here is to put forth a funding mechanism known as a budget that will provide basic health care, that will fund things like community health centers and CHIP, not use them as political pawns, fund them, give people certainty, give our military certainty, give our security folks certainty, and not continue governing from crisis to crisis with continuing resolution to continuing resolution. I have seen firsthand the destruction of these short-term budgets have had for health clinics, our veterans, our small businesses. I just had a group of school board folks in my office yesterday that talked about Impact Aid. These are schools that serve our military and Native Americans, and said how these CRs were limiting the possibility for payments for Impact Aid schools. We've heard from our military leaders about how the short-term CR is wasting taxpayer dollars and hurting our military readiness. At a time when men and women from this great country are stationed around the world, we need to give them certainty. They need to know that we're doing our job as they do their job in incredibly difficult conditions. So for 131 days, too many Americans have been living with uncertainty as a direct result of dysfunction in Congress. This agreement is a step in the right direction, and I am very pleased to see progress on a budget, because 131 days is too long. And so let's get this fixed. And over the coming weeks, I will be more than happy to sit down with Republicans, Democrats, independents who are willing to roll up their sleeves and work to give this country, small businesses, working families, the predictability through a longer-term budget so that they can move forward and be all that they hope to be in the greatest country in the world. With that, Mr. President, I yield the floor.